I'd like to introduce our speaker. Dr. Robert Rowen has the relationship of teeth to medical issues. So a Phi Beta Kappa graduate of Johns Hopkins and the University of California, San Francisco School of Medicine's, double board certifications and recertifications in family practice, emergency medicine, and in clinical metal toxicology. Affectionately known as the father of medical freedom. Thank you for your hard work on that. For pioneering the nation's first statutory protection for alternative medicine in 1990. And lecturing widely in ozone therapy, as we heard this morning, and the importance of the living foods diet. And in October of 2014, he traveled to Sierra Leone to bring the ozone therapy to the Ebola epidemic, and we heard about that this morning as well. And the team has cured 5 of 5 people with Ebola with a 100% recovery rate. So if you could please help me welcome Dr. Rowen and his wonderful mind to our symposium. Thank you.
Thank you. I am not a scientist. I'm not a researcher. I'll read the alleged science, I'll read the alleged research, and I will apply it clinically. I'm a clinician. My patients come to me for me not to treat them based on a double-blind, evidence-based controlled study, the majority of which do nothing to help medicine. I believe we have to address the patients as individuals, and you'll see here. Patients are not numbers. They can't be dumped into a pool. So I'm going to first talk about dental disturbances interfacing with medicine. Remember, I'm not a dentist, but I'll tell you that probably 30+% of what I do in my office is dental related. And I'm really blessed to have my best friend here. Please stand up, Silvano Sen. Thank you. Well, I'm going to need you up here. He's my dentist, he's my best friend, and he sees these people. So if you don't believe me, just listen to him. And the formatting of this is courtesy of some slides I got from Tom Levy. So here's sources of disturbance. Now, when a patient comes to see me, you know, they could come in with anything. They might come in with a knee, and you're going to see the full video of that now. They might come in with cancer, they might come in with pain, anything. I need to look for disturbances in their body. And here are sources of disturbances in the mouth. Endodontically treated teeth, other chronically infected teeth, acute infected teeth, cavitations, lots of them. Periodontal disease, tonsillar infections, implants, especially if they're infected, metals in the mouth. Now, these are disturbances coming from your perspective, and you guys could do a lot of good in medicine. So I could teach you here now possibly how to cure a lot of diseases, because I think you can. Other disturbances could be scars, surgery, injuries, because there's a memory of this embedded in the body, in the scar, or in the nervous system. A woman who was raped could get a disturbance in her pelvic nerves, and she could carry that for years, and it could mess her up physically, sexually, and it's treatable. Physical treatment can treat this. So what about root canals? I'm sure all of you are aware root canals are a real problem, and there's some studies on 5,000 consecutive root canal teeth, and 100% of them have pathogens. The question is, and I was hit up this morning by somebody, Dr. Rowen, do you recommend all root canals be taken out? And there probably are some dentists who do take them all out. I'm not going to quarrel with them. I don't. I go for the target ones. I'm curious, how many of you think that all root canals should go? I respect you. Thank you. But I'll show you what I do in a moment. All root canal teeth produce toxins. No doubt about it. But, like you heard in the hormesis lecture, maybe a tiny bit isn't going to be so bad. So I want to identify what is bad. Root canals, fatally flawed. You guys know all this stuff. 100% of them are infected. Dental tubules are loaded with them. The immune system just can't get there. The worst infections may be the least symptomatic. And I don't know how many people realize that, but I see this over and over again. To me, the more the immune system is seeing it up here, the less disturbance it's going to have in the rest of the body, at least in my field. It says here a successful root canal can be pain-free while harboring infection affecting the body. Apical abscess, I'm preaching to the choir. You all know what that is. Pain in the body. A lot of my practice is pain, tremendous amount. And we have a narcotic epidemic in this country. If I write one prescription for a narcotic in 6 months, I've written a lot, and it's generally for cancer and for a repeat prescription for someone. I don't even write NSAID drugs at all. I see a lot of patients with pain. Most expect me to give them ozone due to its incredible reputation. But I want results, and my ego is involved in getting results with my patients. So I want to look for things that are going to screw up the ozone treatments. And a disturbance in the mouth is one of them. Put another way, is there a distant fundamental cause of a dysfunction that could be out of reach of my ozone therapy? Teeth? Dennis Silvano sends receives most of my patients for dental evaluation. Silvano, if I say anything inaccurate here, speak up. He says that I am at least 90% accurate when I indicate a potential tooth disturbance. True or false? Thank you. And I think you also told me once upon a time that I pick them up months before you do. True or false? Thank you. I don't know how I do it either. Really. He adds, okay, I got to that one. Okay, the German acupuncture chart. How many of you are not familiar with this? Good number. Please get it. It's largely compiled by Reinhard Voll, EAV guru, electroacupuncture according to Voll. I agree with the basic chart I'm going to show you, and I've appended it to this presentation. I'm going to tell you that the chart is not set in granite. Teeth can cross sides. In other words, a disturbance here can affect the opposite side of the body or the same side of the body. And I'll also tell you that any tooth can probably affect any part of the body. So here's the chart. And this is just half. So this is showing here teeth number 1 through 8, and 9 through 16 is just going to be the mirror image of this. So the wisdom tooth, tooth number 1, happens to be energetically connected to the heart and small intestine meridian and anything in its path. It also deals with the sacroiliac joint. Teeth number 2 and 3 and 2 and 3 and the bicuspids, so the upper molars, not wisdom teeth, and the lower bicuspids are connected to the stomach spleen meridian and anything in its path. Stomach meridian happens to cross the knee. The other molars, the lower 30 and 31, and the upper bicuspids are connected to the lung large intestine meridian and anything in its path. Lung and large intestine may involve the arm, the elbow, the shoulder, the nose. All of these are also connected with spinal segments. This chart, you can go online and get it. These are the spinal segments here. Organs, sense organs, and some etheric stuff could be on here. The canines, liver, gallbladder, and the joint might be the hip. And the incisors, kidney, bladder. And that could involve the knee. It could involve anything in the path. So I want to talk to you about some of my findings. This is so valuable. I mean, Dr. Sin will tell you, you can't get into my office if I don't have a dental history. And if the patient didn't bring it, they're going to waste 5 minutes of very expensive time for me to call their dentist and get it. The method I use is a discipline called applied kinesiology. I'm a medical doctor. I thought this was nonsense when I first saw it until it was done on me, and I know my body. And my body felt whatever was done to me. And I just thought, I just watched this guy do it. I can't do that. But then when I came home, this was in 1982, and when I came home from that and I started trying it, I was getting some results and responses from people, and I'll demonstrate it to you today. And that changed my life. That meeting in 1982, seeing this done, absolutely changed me. I just stepped out of allopathic medicine and into a totally different world. I believe that anyone can learn this. I do, but I openly admit that it is a gift. And somehow when it comes to teeth, I was given a gift, and I express gratitude for it every day. Basic technique: select a single muscle and isolate it. I generally use the deltoid. I ask the patient to resist, and you test for how fast the muscle can lock. This is not a strength test. I can overcome you with leverage. The idea is not to overcome you. The idea is to feel how fast your muscle will lock. And if it doesn't lock, that tells me something. To make sure that the patient is testable, I'll sweep a field in front of the patient, or I will place this thing, this horrible thing, on the patient and see what happens. In fact, I don't even want it on me. And I see what happens, and if they weaken, that tells me that the patient is testable, and if they don't, then maybe I need a surrogate. And if I need a surrogate, I'll grab one of my office staff in, and I will test the patient through the surrogate. The technique: assess the speed of how fast it locks, and then challenge the patient's autonomic nervous system by presenting it with a possible disturbance, such as touching a root canal, or touching an empty socket where there might be sitting a hidden cavitation, or touching a tooth that I just think might be there. And then reassess the muscle to see if it does weaken or if it locks. This is how I do it. How many of you do this? A number of you. Okay. So let me give you some examples of teeth that I've followed. Number 9, that's upper incisor. And I'll bet you haven't met a medical doctor who knows the numbers of the teeth, have you? So this should tell you I'm there. Number 9, a guy comes to me and he's got bleeding, blood in his urine. He's been worked up by a main urologist. This is when I was in Anchorage, Alaska, for 22 years, and the doctor couldn't find anything. You got to scope the patient. It's cancer until proven otherwise. It was negative. So he asked his doctor, what do you think of Dr. Rowen? You think he might be able to do anything? And I was a quack up there. So he was polite. He said, nah, he's not a neurologist. He can't do anything. But he was polite about it, at least. The other guys would have said, don't go to him, and said horrible things. He comes to me anyway, and in my history, I just happened to notice, looking at him, he doesn't have tooth number 9. It's gone. And I said, what happened? It got knocked out in a sporting event 25 years ago. So I muscle tested it, and it was weak. So I said, you may have a problem here. I sent him to one of the 3 dentists I was working with. He x-rayed it, and he wasn't sure. He says, I'm not sure. I said, well, I think you're going to find something. Go in. So he went in, and he found a really tiny cavitation, cleaned it out, and the guy stopped bleeding. I have another one from an incisor, which we're going to show you a video of. What about eye teeth, canines? Woman came to me in Anchorage, Alaska, sent to me by one of the biologic dentists. He was my best friend up there, no longer with us. John Walsh, any of you remember that name? No. 4 canines, her root canals, all of them, kind of rare. And she had horrible pain right here, couldn't play softball, you couldn't even touch her. She'd jump off the table. The doctors had done every test in the book, including an ERCP, which is a retrograde pancreatic duct exam, and it has toxicity to do that test. Everything was negative, except she had slightly elevated liver enzymes and she had some fatty infiltration of her liver. I checked her teeth. All 4 canines were positive. He sent her to me for this. I shot him up, and I could mash on her, literally. And I wish I had iPhones then so I could have recorded this. So I sent her back to him. He cleaned them all out. She had no more pain. 2 weeks later, she had a mild resurgence of pain, and she came back to me. I found one of the sockets was positive, sent her back to him. He cleaned it out again. Pain was gone for good. Liver enzymes fell to normal. Tooth number 5, that is large intestine lung, which happens to innervate right here, L4-5, one of the most common areas for back pain. And this occurred at a time when I was the quack of the year in Alaska, and a new governor got elected with my support. And the lieutenant governor sends his wife to me with terrible back pain, headed for surgery, and her x-rays were not bad. They sent her to me for a treatment I was doing at the time called prolotherapy, which is very uncomfortable, highly effective, but very uncomfortable. And she was sent by a guy I had successfully treated. But her x-rays were negative, and she couldn't get her leg up more than this far off the table, about that far off the table. And I said, do you have any root canals? Yeah. Do you know where they are? No. So I just started muscle testing them one at a time. She had 2 root canals. One was in the left bicuspid. I injected that with a little bit of numbing medicine. I use 1% preservative-free Procaine at the odontin point, which is on the gum, like right here on the buccal side. And it helped her maybe get that much further. Then I did tooth number 5, and she jumped off the table and started dancing, and she said, what did you do to me? This was a woman who needed assistance getting into my office. And I said, Francis, remember, this is the lieutenant governor's wife, and he's there. And my butt was on the line because I wanted to be appointed to the state medical board, which I was about 6 months later. So I said, Francis, I'm not going to inject you. There's no reason to. I'm going to send you back to the Capitol. You're going to see a dentist there who's going to x-ray that. 3 days later, I got a call. He found an apical abscess on that tooth. He said, what do you want me to do? I said, get rid of it. He did, and she lived out her days pain-free. Number 17, that's wisdom tooth, heart, small intestine meridian. I've seen a number of heart rhythms coming from amalgams in a wisdom tooth. And my hunch is that the amalgam is just pouring electricity into the heart meridian and causing disturbances. I've also seen it cause sacroiliac dysfunction. So when I shoot it up, the sacroiliac pain goes away. Now, number 6 is real interesting. Silvano saw this one. You remember her? The woman from Southern California with the hip abscess? Oh my goodness, he said. Okay, this woman is an actress, not high level. She came up to me from Los Angeles with the swollen hip. You can actually see it, and it was red. Her orthopedic surgeons told her it was septic. 2 cultures are negative, though, but the MRI showed that it was septic. And it was red and swollen, and they said that they're going to have to she had 2 prosthetic hips. Remember, these are prosthetic hips. And the doctor said, and the infection occurred about 9 months after the prosthesis was put in. The doctor said, we have to remove the prosthesis, and you will have a flail leg, which is going to sort of hang around in the breeze for 3 to 6 months. You're going to be in bed for 3 to 6 months without a hip joint. We have to pummel you with antibiotics intravenously and into the space. And this is what they offered her, and she came up to me for ozone. And when I saw the hip, yeah, I said, this is swollen. So she let me put ozone into the joint, which I did. I put ozone gas right into it. And of course, I'm in her mouth, and I found, what was that, number 5, Silvano? Number 5. I said, you got a problem in number 5, go see Dr. Sen. She did. And what was the lesion? Apical abscess? Glaring apical abscess. Not clinically obvious. She didn't know she had it. Totally asymptomatic. And I sent her back to Los Angeles, where she would have definitive work done on it. She would continue to get ozone therapy systemically, and I don't think she got another injection in her hip. I'm not sure. Now, there is not a report anywhere in the world's literature of a prosthetic hip sepsis being remedied by anything short of at least intravenous antibiotics, at least, and preferably surgery as well to do what the doctors wanted to do. The third culture, when she went back, was positive for oral organisms. Hello. She had her tooth done, fixed. She continued to get ozone. Once they found the oral organisms, they said, you got to get the prosthetic hip out and get all these antibiotics and treatments. But they did start her on oral antibiotics. She continued to get ozone, and she is totally symptomatic free to this day. Infection went away. I'm trying to get it published, but the damn orthopedic journals say, oh, the first 2 cultures weren't positive. Well, they weren't positive, but she had 4 orthopedic surgeons, including big-name institutions, ready to take that prosthesis out and leave her without a hip joint for months. So that's number 6, septic hip. And then we have number 14 and 15, a woman with crippled knees. And, this one? Yeah. Yeah. We're getting to that. Patient history. You can't walk into my office without a dental history. I want to know where all this stuff is, and I'm in your mouth and I'm checking it. And remember, I'm not a dentist and I'm not competent to do a dental exam, but I'm a physician and I have to determine if the tooth is having a relationship with the rest of the body. Listen, people, you're dentists. Your responsibility is to the teeth, and you have a responsibility to know if your field is screwing over the rest of the body, because you can fix it. Weston Price did the basic research in the last century. He found if you took out an infected tooth, a root canal, and stuck it into an animal, that the animal would get the same symptoms the human host had. Hello, why isn't this being taught in dental schools? Today we know that not only do they harbor infection, they're putting out thioethers and all kinds of horrible toxins. So if a tooth tests positive, I'll inject a tiny amount of preservative-free 1% procaine into the odontin point on the buccal side of the gum. And what we're looking for is a relief of pain in the target area. I want to see at least 50% to decide that that tooth is suspect. And if it's 90%, which is common, I'm about 100% certain that the tooth is involved. Dr. Sen, what do you have to say about that? Dr. Sen just said that when we do this and they get close to 100% relief of pain, it's 100% accurate. And sometimes we get 100%. I mean, if it gets 80%, that's good enough. And I don't, to get 80%, I mean, some of these people come in with x-rays that look like their backs are destroyed or their knees are destroyed. And to walk out of the office without pain simply because I shot up the teeth. I'm shocked that they leave not in pain considering the level of destruction in their joints. Scars, injuries, and surgical sites, they all can be energetically disturbing. So not only do I look at the teeth, I look at scars on the body. The TMJ is an interference field too. And I'm just now expanding my work with TMJ by injecting ozone into it, and I'm getting bigger cojones, I guess, with doing this now. I'm using more and more ozone into the TMJ, and I'm actually seeing better and better results as we do this. Initially, I started with just a couple cc's because I thought it was a small joint, but I'm doing a lot more now, in part because I've learned more about the TMJ from another dentist in my area. And I think that the TMJ is irritating the fifth cranial nerve. And when it irritates the fifth cranial nerve, it goes back into the brain, and you're going to get an outpouring of substance P in the brain, which is a pro-inflammatory molecule, and really get the body off kilter. This is based on neural therapy. There is a book called Manual of Neural Therapy According to Huneke. This book is a must-read. You can get it at Amazon. I got this book in the mid-1980s. I read it cover to cover. It is extraordinarily relevant to you. Now, the teeth are absolutely relevant, but this deals with the rest of the body. You guys are health professionals. You're going to see people come in with disturbances, and you might be able to help them out just by pointing them in the right direction once you understand the interrelationships with the rest of the body. The leading teacher of neural therapy in the country is Dietrich Klinghardt. But I'm doing a lot of work with mouth right now. So I will demonstrate the technique, but I want to show you some cases. The next one is Daniel. I mentioned him this morning. Daniel came to me several years ago. This is how I saw him in my backyard, and my heart went out because 4 weeks before this, he looked okay. And then all of a sudden, I see him like this with blotches all over his body. He's a laborer. He's a field hand. His muscles were so sore you couldn't even touch him, and he was afraid he was going to lose the ability to support his family. In my backyard, I said, open your mouth. I looked in his mouth and I muscle tested him, and I identified about 3 teeth, and I said, you're going to have to get these done, and I don't care how you do it. And I started treating him with ozone in my backyard. Silvano, what did you find when he went to you?
Numerous long-standing chronic abscess teeth. He just takes care of his family, doesn't take care of himself.
Numerous chronic, long-standing abscess teeth. And I think you did a little bit, but then he went to see somebody in a garage because that's where he could afford it. And I kept doing ozone on him. And after he got them all done, the ozone got all of his inflammation down. He was able to work and do everything he needed to do to make a living. After he got all of the teeth done, we were able to get him off of all of his drugs, and that's how he looks now. The next one was the septic hip, a woman 65. I've already presented that one to you. She's a recent case. By the way, I'm trying to get Daniel published. I can't, the journals, never mind. I don't want to get into what's going on with the journals. And the orthopedic journal, they thought it was interesting, but because the first 2 cultures were negative and Mayo Clinic wanted to carve her hip out, they didn't think it was infected, so they wouldn't publish it. Today's March 1st, 2018. We're here with Casey and her husband. Yep, got it. And both of you have given me permission to video this, correct?
That's correct.
And I want to get results and put you up on YouTube. Is that okay?
That's correct.
Thank you very much. Okay. She's got hip problems, back issues. Actually, I want to do the next one. All right, this is March 1st, 2018. We're here with Casey, and her husband's in the background, and both of you have given me permission to video this, correct?
That's correct.
And I want to get results and put you up on YouTube. Is that okay?
That's correct.
Thank you very much. Okay. She's got hip problems, back issues, and neck issues, and she's got some root canals. So what we want to do is see her get up out of the chair and walk to the door. I don't know if you could hear her, but she actually cried getting up. You could hear her voice. And you don't look too happy. All right, sit down. Okay, now I'm going to have you get up on the table. This knee is a problem. You're hurting when I do this, aren't you? Yeah? Look at her. You got her face? Yeah, she's hurting. Look at her. She's in a lot of pain. Okay, that hurts. Just to come down here and get this range of motion, please. Okay. I inject tooth number 15. Watch this. Tooth up here. It's tooth number 15, and I'm going to bend your knee. Let's see what we got here. And
Oh my god, it just feels so much better.
Are you getting her face?
No.
Get her face.
Okay.
What was it that you said?
It just feels so much better.
Look what I'm doing to your knee now, and I couldn't do this
Well,
before.
okay.
And
Jeez.
get her face, please.
Yeah, it feels so much better.
All right, and look what I'm doing to your knee now, and I couldn't move it before, okay? I have only done tooth number 15 so far. That's all I've done. Let's get her cane. Now remember, she came to me for ozone injections in her knees, remember? You can walk to the door. We want to see how you walk. Watch this. Now I say that's a lot looser.
It is. It feels a lot better.
Are you crying because I hurt you?
No, I'm crying because I'm happy.
Walk to me, please. Wow.
I know. I don't.
You were like,
Need the cane?
I don't even think I need my cane.
look at this. Oh my God, I'm blown away. I got to tell you, I'm blown away on this one.
Yeah,
All right.
it's good. It's
We're gonna-
really good. You're good, doctor. You're really good.
We're gonna do your another tooth now. I just want to see
Okay,
a
do
little
them
bit.
all.
We're done for the day and you're about ready to leave. Can we
Yep.
see you get up?
Yep.
No hands.
No hands.
Walk to your husband, please. All right.
Thank you.
Thank you, and I want to thank you very much, both of you,
Thank you,
for
Doctor.
giving me permission to use this video.
Oh,
You bet. Thank you, doctor. I hope it helps a lot of
Yes.
people.
Okay, what was truncated, unfortunately, which is on my YouTube channel, is I did have a picture of her knees, x-rays that showed medial compartments were destroyed, basically bone on bone. So I was shocked that just doing her tooth got this kind of result on her knees. Dr. Sen, do you have anything to say about this? Yeah, she's doing fine. Right now, the amazing thing about this particular case is the results lasted for days. I don't expect that because sometimes the pain will come back as soon as the local anesthetic wears off. All I did, and I did end up injecting her knees because of the bone on bone. I thought she would get some help. But suppose I injected the knees first. You know, the energy disturbance, setting her knees up for inflammation, was still there. So Dr. Sen said she had five root canals, right? 5 root canals. I said 3 were positive, and only those 3 were positive by your x-ray. Is that correct? So the chances of finding them the way I did would be 2 to the 5th, because I got all 5 right. This is why I typically don't recommend all the root canals being pulled out, because people need to chew as well. And I don't want to be the one who condemns them to a life of inability to chew. Add. So what Dr. Sen said, for those of you who couldn't hear, is by whatever means, I've been blessed, and I'm openly admitting that. And generally, I can pick up if there's a problem. I'll be happy to have somebody here with a root canal come up and I can test. And when I might inject it and the problem doesn't go away, that I'm looking to go away, that happens. Then I go right for the joint. Then I go right for the money with my ozone. But I always go for the mouth first. I want to show you some of these videos. I'm not going to play them all for you. Here's hip degeneration due to a root canal. Oh, you can't see it. I got a guy, Toby's back, instant miracle, seeing is believing. He's another one. This guy came into my office and he could barely walk. He could barely get up on the table. He's on my YouTube channel. He expected me to shoot up his back. I didn't even shoot up his back. I found root canals here and I videoed him before and after, and I'm getting better at making sure I video them before, because if I don't, no one's going to believe this. By the time we were done, here's a guy who couldn't get his legs up onto the table. He just was able to jump up on the table after I got to 2 teeth related to L4-5. Then there was the young lady that I sent to Silvana who had frozen shoulders. Remember her? And it was wisdom teeth. Remember that? And after I shot them up, she was doing jumping jacks, right? You treated them and you found cavitations in there. Who's got pain somewhere in your body, or who's got a root canal or missing teeth? Come on up. Let's just play with this a little bit.
Do you want to play this one?
No, I just want to show them here we go. I've only got 5 minutes, so we've got to be pretty quick. So, come on up here. Problem.
Number 31. Got a root canal when I was 20. Had it retreated when I was...
And any symptoms related to it?
Currently, it's bothering me. It looks fine on the x-ray. It's not great on a CT.
Hold. And now I'm going to bring the energy up. Hold. This business like this is just interfering with an energy field to see if she's testable. And if she's not testable, then I can't do it. Go ahead and touch it, please. Put your finger in your mouth and touch it. Hold. Okay, they can't see. Okay, we're going to do it sideways now. So what we're doing, what I'm doing, and sorry, I put your arm out, one arm. Hold. Okay, I'm just going to sweep down the energy field, hold, interfering with it, and you got weak. You feel it? Mm-hmm. Okay, now I'm going to come up, bring the energy back up, hold. That tells me you're testable. Now, what's the problem in your mouth?
I lost my tooth number 8.
And do you have any problems in your body?
Implant. I have a wrist problem and a knee.
Okay, tooth number 8, kidney meridian, generally back and knee, and kidney meridian is related to bones. Hold. So she wants to see if the implant is an issue. Hold. It's fine. I would not tell you to do anything with it.
Okay, thank you.
You're welcome.
Root canal, number 19, 15 years ago.
And back pain. Back pain down here?
Thoracic.
Thoracic. Hold. 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 Please touch it. So now she's just touching it. She'll either touch the root canal or she'll touch the space where the tooth is missing. Hold. I don't see it as an issue. At least I don't see it as an issue. Hi.
Endo teeth extracted.
You have teeth extracted? Which numbers?
Wisdom teeth and buys.
And do you have symptoms possibly in your body related to it? Yeah? All right, so let's first check the wisdom teeth. Go to number 1, please. Hold. Wait a second, let's make sure you're testable. So I'm going to go down, hold, weak. Now we have to come back up, make sure you're restored, hold. Good. All right, 1, hold. 16, hold. 17, hold. Hold. Now, the buys were removed. Okay, touch the gum where the buy was removed. Elbow straight, please. Hold. Next one. Hold. I'm not finding anything. What'd you say?
Root canal teeth.
Which one?
8 and 9.
Root canal teeth 8 and 9. Hold. Bang. Number 9, please. Hold. Number 9 is good. Do you feel the difference? Is there any question in your mind?
No.
Please tell these people. Did you feel the difference?
Totally. My husband's an endodontist.
Okay. Did your husband do it?
No.
I'll tell you, if they put me out of business, if I get put out of business, Silvano says that maybe one of you guys would just park me in your waiting area and I could be testing the teeth as they come in all day long, because I think I can make a good living that way. Problems?
I got shoulder that's getting stiff, and I've had back.
What teeth?
What teeth I'm missing? I'm missing my 6s, and I've got 6 root canals.
6 root canals. Okay, which teeth?
Central lateral.
All right, well, let's check them. Hold. Hold. Now we'll come up. Be as strong as you can. Hold. This is a very subjective thing. It is not objective, it's not scientific, and this is why I have no business with double-blind controlled studies, because you can't control for this type of thing. You put people in with endodontically treated teeth into a study, you don't know what you're getting. All right, so I'm going to let you touch the teeth you want me to check. You know where the root canals are. Keep your elbow straight. Hold. That's all right. Hold. That's all right. Hold. That's all right. Keep your elbow straight. Hold. Elbow straight, please. Hold. Which one is that? Okay, so that's a lateral incisor, or is that the canine? Lateral incisor, okay. Elbow straight. Hold. You got some problems in incisors. Check it out. Let me know, please. Hi. My collection agent's at the door.
Upper shoulder and side.
And what teeth?
So 18 and 19 were root canaled. Then I got 18 out. Still kind of pain.
Elbow straight. Hold. Hold. You're testable. That's what counts. Hold. Elbow straight. Hold. Good. You touch the teeth at the places you want me to check. Elbow straight. Hold. Next one. Hold. Good. You passed. Did you feel me lay into you? I really laid into you. Yeah. I mean, yeah, I pressed hard. The goal is not to overcome the patient. I've got the leverage. The goal is to feel that arm lock. And if it doesn't lock, then I'm assuming there's a disturbance. Hi. Number 12?
Sinus issue.
Sinus issue. I see a lot of sinus issues with number 12. Lots. And that would be maxillary sinus according to the chart. Hold. Hold. Do you feel the difference? Hold. Good. Take a finger. Touch number 12, please. 9, 10, 11. Elbow straight. Hold. Go check it out. Get an x-ray. Anybody want to hire me? I'm willing to come. Wrap it up. I got to go.
One more.
One more.
I got 14-9 root canal, knee, sinus.
You have a knee?
I do.
Number 14. Maybe. Hold. Could be. It could also be. Hold. Whoa. Hold. Good. Number 14. Touch it, please. Hold. There could be a problem there. You said number 9, so right there. Elbow straight. Hold, please. Yeah, good.
Okay.
All right. So this is what I do all day long, all right? In my office.
15, 16, and 17.
Okay. I've found autoimmune diseases related to this, local problems related to this, back pain. You've seen some of the better ones. Go to my YouTube channel, please, and look up the dental ones. They're phenomenal, and Sen will vouch for them all, won't you? Sen? They're real, aren't they? These are real patients. Actually, they're pretty good actors. I had to pay them a lot of money. What are we dealing with?
15, 16, 17.
And do you have medical issues too?
Yeah, a lot.
A lot? Hold. Come on, you got to help me.
Okay.
Hold. Good, that's what I want, all right? I'm not overpowering you. Hold. Weak. Hold. You got to help me. Hold. I just want to double check because I'm not getting good cooperation from you. All right, hold, hold, hold. Okay, that's what I wanted. Touch the suspect teeth, please. Hold. That one's good. Next one, hold. That one's good. Next one, hold. No, do it again. Hold, come on. That was good, it locked. This is why I don't have everybody take them out. But I tell them, if you have a root canal, you're welcome. If you have a root canal and you get strange things, just keep it in mind, because it could come later. Might not come right off the bat. What you got? Do you have any problems in your body?
Yeah, I have for the last year.
Number 2, root canal. What kind of problems do you have? It's in the stomach spleen meridian.
Stomach.
Stomach problems?
Intestinal, stomach.
Elbow straight. Hold. I'm going to sweep your chest. Hold. Weak. We're going to come up. Hold. Touch number 2, please. Hold. Do it again. Come on. I need your help.
Okay.
Hold. I think you have a problem there.
I thought too.
Okay. Sometimes patients don't tell me what's going on, and after I do this and they get weak, when I say, I think you got a problem in that tooth, they say, well, doc, I didn't want to tell you, but I've had a problem there. And then they fess up after I find it.
This is turned off, and I have 3. It's turned off.
I don't care.
I have 3 endo teeth, 5, 10, and 31.
3 endo teeth, 5, 10, and 31, and what kind of problems do you have? He's got aches and pains. Hold. 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 You're a little tough. Let's put mine on. It's turned on. Hold. Now I want you to be as strong as you can. Hold. Okay. So I think I can test you. Touch number 5. Hold. Good. 10. Hold. You got a problem there. 31. Hold. Did you feel the difference? You have to feel the difference, not me. You have to feel it. Okay. Yeah. That's a pretty good demonstration when I lift my body weight up on somebody. They're giving me extra time. What you got?
I have 4 root canals, back pain, neck pain, right joint, and a lot of other.
People like you, I see people like you all the time coming in expecting me to do ozone, and I do, but I got to be in your mouth first. Which teeth?
Okay. 3, 4, 14, 15.
3, 4, 14, and 15. So you got all the meridians. 14 and 15 are stomach spleen, and 4 is lung large intestine. So you may have pain down here. You may have pain around here. Put your arm out for me. Hold. Sweep your chest. Hold. Weak. Feel the difference? We're going to come up. Hold. I need your help. Hold. That's what I want you to do. When I say hold, lock it. Touch 3. Elbow straight. Hold. Not bad. 4. Elbow straight. Hold. Do it again. Hold. Look at her face. What's the next one? Elbow straight. Hold. So I would go for 4 first. Now, the other thing that's important is, if she was in my office, I would shoot up number 4, see what happens to her pain in her body, and then I would go recheck the other 2. Because sometimes I don't find them all until I take out the worst. And when I neutralize the worst and I get that out of the disturbance, the next one shows up. One more. What are we testing? Elbow straight. Hold. It's good.
Wisdom teeth extractions.
Wisdom teeth extractions. Do you have any problems?
Some weird things.
Weird stuff like what?
Autoimmune stuff.
Autoimmune. Charm out. Hold. Hold. Oh, you're easy. Hold. You're easy. Don't take that personally. Hold. Good. Take your finger, touch number 1, please. Hold. That's good. Again, I know instantly. As soon as I say hold, I can feel the muscle lock. Hold. That's good. Hold. That's good. Elbow straight. Hold.
Okay.
They seem to be okay. Last one. I get a workout. If you have autoimmune disease, it still can be treated. Okay? It doesn't have to be coming from the mouth. Yes?
2, 3, 14, and Ehlers-Danlos hypermobility associated pain.
I don't think they're related. Ehlers-Danlos is not related to your teeth, but you have 2, 3, and 13.
14.
Any other problems besides Ehlers-Danlos?
Just the pain from the hypermobility.
Okay, put your arm out for me. Hold. You're nice and strong. I'm going to go down. Hold. There's an energy field in the front of the body called the conception vessel. Elbow straight. Hold. I've often wondered if the martial artists, when they take you down before they even touch you, are nailing that energy field, and it weakens you before you even get close to them. Touch the tooth, please. This is number 3, correct?
2.
2. Hold. That's good. Next one. Hold. Next one. Hold. You pass. Thank you. Thank you all for being here. This